Hello everyone. Next, let's talk about why patients may develop pulmonary thromboembolism and how it may affect patients' physiology. Here, let's take a look at this virtuous triad. This virtuous triad includes three factors: stasis of blood flow, endothelial injury, and hypercoagulability. These three factors may affect patients' prothrombotic states. The more factors patients may have, the more likely they may develop pulmonary thromboembolism. Here we can see a lot of things are included in patients' prothrombotic states. Some are genetic, some are acquired. For those genetic, here we can see autosomal dominant genetic mutation, like factor V Leiden, like prothrombin. They all can mutate and cause patients' prothrombotic states. And some disease like anti-phospholipid antibody syndrome can also cause these prothrombotic states. And many medical situations like cancer, obesity, cigarette smoking, systemic arterial hypertension, chronic obstructive pulmonary disease, chronic kidney disease, blood transfusion, so many things can cause prothrombotic states. Actually, we can classify these factors because they have different weight in causing the pulmonary thromboembolism. Some are strong, some are weak. For example, fracture of lower limb is a very strong risk factor for the developing of pulmonary thromboembolism. And major trauma, hip or knee replacement, spinal cord injury, these are strong risk factors. And for moderate risk factors, we have blood transfusion, we have central venous lines, we have chemotherapy, also so many things. We're not gonna go through them one by one here. And of course, we have weak risk factors. For example, bed rest for 3 days. It's weak risk factor, and diabetes and hypertension, they are all weak factors. If patients develop pulmonary thromboembolism, they may have increased right ventricle afterload, and they may cause right ventricle dilation and tricuspid valve insufficiency, and this will increase right ventricle wall tension and activate neurohormone system and cause myocardial inflammation. And right ventricle, its oxygen demand may increase and its contractibility may decrease. And then, of course, its output will decrease, which may in turn cause decreased preload of left ventricle and low cardiac output. And systemic blood pressure get lower and lower, and the human body have less coronary perfusion and less oxygen delivery. A very complex physiological changes we can see here. If all these changes are so severe, patients may even have cardiogenic shock or even death. So we can see here, pulmonary thromboembolism can really cause a lot of trouble. And we've seen all these changes actually in that pictures, so we're not gonna read all these words. Okay, that's all for why patients may have pulmonary thromboembolism and how these disease will affect patients.